We're doing it and starting 2 p.m. Eastern time. We have our speakers, and I'll talk about them in a moment. But real quick, Nigerians in Diaspora, Ohio is one of the hosts of today, and I'll let Shami talk about the African. But really, Nigerians in Diaspora is a nonprofit organization. We draw resources from Nigerian professionals in diaspora. We instill ethical consciousness, civic responsibility, that will enhance our socio-economic advancement of Nigerians, and for all lovers of Nigeria also. We've actually been registered as a 501c3 organization. We focus on professional networking, social advocacy, women's development, education, healthcare, technology, and every cultural exchange you can think about. I don't work alone. We have a mission to promote patriotism. We do have a couple of great guys and women that actually work with us, and we'll see them as they come on. We have our website, NIDOA Ohio, NIDOAOhio.org. That's www.NIDOAOhio.org. And we'll share that as we go through the process. But I'll stop at this moment and say thank you again. We had a session last month, and this time we are partnering with the African to bring this resource to you. So thank you. I'll start back and let Shami give us some quick intro about the African. Go ahead, Shami.
Joanne was just here. Are you still here, Joanne? No.
I'm here. I'm here.
There you
go. Go ahead, mommy. Go ahead.
Okay. Hello, everyone. I am sorry I had technical difficulties. Of course, I don't know how to use Zoom still. But anyways, I'm just hoping to share a little bit about the African. So the African, our goal is just hoping to educate and advocate for the well-being of our community. We are united together to celebrate culture and to promote engagement within the Central Ohio African diaspora. We typically host a meetup every month, and we usually will discuss issues relating to the Africans within Ohio or African diaspora within the continent of Africa. Mostly engaging conversations how to improve our lives here, and also how to be of service to our families back home. You can always find us on social media at The African, either on Facebook or Instagram or Twitter. We're usually active on social media. And currently we are working with the state of Ohio in promoting the current census. So please, if you have not, I'm gonna put a shameless plug in already here. If you haven't filled out your census, it is important for us to be counted as the African diaspora, so that at least some of the resources will come back to our community. Our goal is to advance the lives of our people within our community. Thank you so much for listening, and I am looking forward to this wonderful conversation today.
Thank you so much, Joanne. Let me go ahead. Shami, do you have anything before I introduce the speakers? Let me let you do that.
No, go ahead.
Thank you so much. All right, let me go ahead and introduce some of our three speakers, actually. We have someone else that is going to join us in question and answer piece too. But let me let you see the resources we have here today. One of them is actually Rochelle Martin. Rochelle Martin actually has over 35 years of public service experience in the healthcare field, coordination of healthcare systems nationally and internationally. Currently, she's the executive director of the National Alliance on Mental Illness over Franklin County. She was formerly the director of Training and Prevention Network, service manager for ADAMH, Board of Franklin County, and a co-founding partner of the Suicide Prevention Foundation. She's been a project coordinator for the HIV Outreach Demonstration Support Project, sponsored by the Center of Substance Abuse Treatment. She was a team leader for Drug Abuse Prevention and Control Project, sponsored by the United States Agency for International Development, USAID. She's a member of St. Dominican Catholic Church in Columbus and a Dominican sister of Peace Associate. She was formerly the chair of the Martin de Perez Advisory Board and the former executive director of the Black Catholic Ministries. Let me go ahead and bring her on before we get our other speakers, and we'll introduce them also. So Ms. Martin, over to you.
Good afternoon. It is an honor and pleasure to be able to speak to the Nigerian diaspora today. I want to first start by giving you some information about NAMI. NAMI is, I'll give you the mission statement. We are dedicated to improving the lives of people who are living with a mental illness and their families, and we do it by a number of ways. We do it through advocacy, support, education, referral, and outreach. And we provide a number of programs to our community, one of which is called the Family to Family classes. They are 8-week classes. They are designed for families who have a loved one with a mental illness. And in those classes, the families are taught a number of things. First of all, they get a binder of 1,000 pages. And in the binder, they learn such things as the different types of mental illnesses, the drugs that are associated with the mental illnesses, the treatment that is associated with them, and how to communicate with your loved one with a mental illness, because it may be a little different, because the loved one is dealing with a brain disorder, so the communication may be slightly different. Also, one of the things that they teach is how to take care of yourself as you journey through this mental illness. The classes are taught by family members, by people who have a loved one with a mental illness. Here in Columbus, we have a state trainer that teaches all over the state of Ohio people who are interested in becoming teachers for family-to-family classes. We also have classes for people who are living with a mental illness. Those are 8-week classes. They are taught by a person who has a mental illness, and they learn such things as an advanced directive, how to write one, how the different types of mental illnesses, the medication that is associated with them, communication skills, and they also get a binder filled with information. We have support groups. The support groups are geared for families who have a loved one with a mental illness. Currently in Columbus, we have 8 support groups. We have a Hispanic support group. We have a support group for men. We have support groups that are located all throughout the county of Franklin County. We have one in Bexley, one in Grove City, one in New Albany, and the rest are in Columbus. We have support groups for people who are living with a mental illness, and they are led by people who have a mental illness. We have classes for parents who have a young child with a mental illness. Those classes are taught by a family member who has a child with a mental illness. They are 8-week-long classes, and they are designed to teach specific things for them, and they get a binder as well, filled with information that they can use. We have a support group for parents as well. We have a class called Ending the Silence Those classes are for young kids that are in high school and middle school. We teach them about mental illness, and we take 2 young adults who are living with a mental illness to tell their story. We have adults that teach the class as well. And in these classes, kids have come forward and talked about their mental illness, their plan, if you will, to take their lives. And we have gotten them help and services. NAMI is one of the best organizations that I have ever worked in. I have been there for 12 years now. We are dedicated to helping people who are living with a mental illness and their families. And with that, I will stop and take questions later.
Thank you so much. Appreciate it, Ms. Martin. We definitely appreciate your time, and you actually stood to the time. We appreciate that also as we're running through. She's a great resource. She was actually referred by the Columbus Public Health, and they said this is one of our best resources. Let's use her. So put your questions in the group chat. We will answer that as we get to the question and answer session. We are currently live on Facebook also with our people outside here. Without wasting too much time, I'll also speak about our next speaker. She's a great person. I met her on one of these Columbus Public Health Advisory Council meetings, and she has done a lot in the community. Let me talk about her. Let me go ahead and share some information about her. There we go, Dr. Cox. All right, so Dr. Chikako Cox, she's a PhD in clinical psychologist from Japan. She completed her clinical psychology internship and postdoctoral residency, specialized in adolescent psychology and neuropsychology with NIMH, Asian American Psychology Training Center, Community Mental Health Center, and General Hospital in San Francisco, California. She was involved in Asian American AIDS Task Force, Jungian Institute, and psychodrama training. I apologize if I do anything wrong there. Her expertise areas are Asian psychology, cross-cultural psychology, adolescent psychiatry, Zen meditation, Jungian sand play, and Zen Hakuniwa therapy, domestic meditation. Now, in addition, Dr. Cox is actually trained in mind, body, spirit psychology, EMDR, Alexander technique, Qigong, yoga, sports psychology, creative play, art therapy, and energy work. She's appointed as a member of Ohio Governor's Advisory Council on Asian American Pacific Islanders Health Committee as the only Japanese psychologist. She has received numerous awards locally and nationally, listed as one of the pathbreakers Ohio State women who made a difference. She's actually involved with MSF, Doctors Without Borders, as a trauma specialist. Dr. Cox registered with International Olympics Organization as a sports psychologist with her sister, Dr. Yuko Ino, MD in Japan, have established peak performance sports medicine consultation and travels all over the world. She's currently studying the molecular medicine and additional license to provide comprehensive preventive health care. Let's go ahead and unmute Dr. Cox and let her speak and help me out with all these big words that I couldn't say. Thank you, Dr. Cox.
Thank you. You know, obviously I have a lot more time this summer because my sports psychology role for Tokyo Olympics is gone. So, you know, that's why my professional and social, you know, there's no traveling and, you know, no Olympics this year. So I'm very disappointed, but I'm still able to work with some of the Japanese athletes. So that's a good thing, but remotely. So anyways, thank you for the invitation. And I feel really passionate about, you know, looking at holistic, you know, health. And mental health, of course, is a huge part of this. And my heart is just breaking out for Minnesota incident, and this is just one too many of the incident. And I'm really involved in the critical incidents team, so I may be called in the middle of the session because of the emergency in downtown Columbus at this time. So I have lots, like I said, I have a lot of things to kind of talk about regarding mental health. And so one of the things that, thank you very much for Rochelle, Miss Martin's presentation. But what's important, and I think Kola had the question too, is about stigma regarding mental health. And obviously I work a lot with the Asian community, and the same with I think very similar pattern of African community is the underutilization of mental health, because of the stigma is attached, right, for mental health issues. So what we do is, as an immigrant or as an Asian or African, we wait until the last minute to access the mental health help, whether it's a hospital or community mental health or, resources like NAMI. So we have such a severity problem and not much of a preventive area of mental health. And especially with this quarantine and COVID-19, it's really a wonderful opportunity for all of us to look into what are the triggers and some of the things that we might be able to do to prevent any severe development of their mental health. And one of the things, of course, is isolation, for what are the resources, for instance, even, with all this teaching that I do and training supervision, we still don't have enough of an Asian or Asian American mental health providers in Ohio. And so we're not only talking about medical translators, but also the actual therapy, actual diagnosis, actual assessment, all this psych testing and neuropsychology, how to work with a psychiatrist about medication, because some of our diet is very different, especially as a first or second generation. Third generation, what happens, right? For your community too, it's all about hamburgers and pizza and spaghetti, right? And hot dogs, so then we don't really have to worry too much about medication interaction with those folks, but so there are a lot of those denial as a community, and we just keep silence. If there are any other domestic violence, family issues, some of that sexual assaults, all those things are things that health and also mental health related, but we'll continue to just keep, secret, and a lot of that denial. And so, of course, the question is how to go about, helping each other is just something like this, having this mental health as again, is, some of the population that NAMI deals with is a pretty severe brain neuropsychology problem, and then there's some stress. So there's a range of mental health problems of stress to the severe psychopathology. And then, of course, there are just all kinds of complexity and a range in between. And like we see, like today or this week, the Minnesota incident triggers people who have been kind of okay, but they're reliving that PTSD and trauma, or COVID-19 alone may again trigger, some of that problem, addiction, family dynamics, all those things have been really triggered to exacerbate the severity of mental health issues. So what might be important is having this kind of forum in a community to just have this is what we used to do in Asian Festival, which is, of course, is gone this year, is we just talk about stress, and that's why I think this is a really good topic that you have for today's discussion is, we can really talk about stress as a physical problem, or life habit problem, You know this, right? When you get stressed out, people drink more, people smoke more, people eat more or eat less, or sleep more or sleep less, so we can really look at some of the personal habits and addiction and stress. So that might be a really good way of really educating the community about what is stress. And for you, do you get headache, or do you eat more? And I do this with the kids too, going into the kindergarten, going into the elementary school, and talking about what's stress, and like mom and dad, fighting, or going back and forth to different homes, so, or language may be a problem, or the food may be a problem, okay? So there are a lot of things that I think we can do to educate people, and not so much of a brain disorder or mental health, that may just kind of say, oh, no, we don't want to talk about this, or something like sexual assault, domestic violence. Oh, no, we don't want to talk about this, So that's a way that we have been doing to just really educating people in a way that will be helpful, And then, of course, the resources is really important. Lastly, well, there are a couple more things too, but I'm just kind of watching that my timeline as well, is regression. As you know, the stress like this, whether it's a COVID-19, the riot, or economic issues, and a family fights or dynamics or addiction, while you're recovering. Regression is you just kind of retrieve into a little kid, or just your old way of dealing with a problem. And for many of us, who are immigrant, of course, comfort food, tradition, our songs and dance and music and arts, it's not available in Columbus, Ohio. I don't know about you, but when I get stressed, I'm cooking Japanese food and, having this Japanese rock and roll, and all this comfort things that I remember as something of a comfort of my home, So that's the kind of stuff that you can all, connect to each other. If there's some kind of comfort that you need, that's tangible, something that you can touch and smell and eat, that's not available. So whether it's a Nigerian folk songs, or some kind of pop songs, or some kind of fables and stories, some comfort food, something that was like a home, or something like you belong. That's another way for taking care of yourself as a community, so that we can have the basis of a unity and also empowerment for the resilience. I have a couple more things, but then I just wanted to make sure to kind of keep the timeline for any questions that you may have. But there are a couple more strategies that might be helpful as well too. So, okay, well, thank you.
Thank you, Dr. Cox. I'm not sure if you wanted to go through your slides.
Okay, well, I mean, it's, well, let's wait. It's, well, so the slides that I have is AP, American Psych Association, have put together, every year, they put together the stressors. And so they have compiled 2020 of what are the stressors, and they break it down to the generation, And what's so interesting to me was looking at the statistic from last year for the ethnic population. Number one, was a public shooting was one of the, major stressors, that we are afraid to get shot, in a mass shooting, or be mistaken as a criminal. That's one of the number one. But of course, this year, that's gone. It's all number one economics, and health, and especially with the COVID-19, family with, as a parent, family with children with that parental responsibilities, they're suffering the most, in terms of this COVID-19. So that's why we have been developing a lot of how to deal with that COVID-19, as a parent, population. And that's one of the discussions that we had in the public health about a month ago. And so that's another resources that we have. and I can just put it out, how to kind of stuff. Yeah, that's I just wanted to point out, just again, it's easy way to talk about mental health, maybe about the stress, what's economy, parenting, family responsibility, addiction, or life habit, those are the kind of stuff that might be important to kind of look at. So if people have any more particular questions regarding what are the stressors in the United States we have compiled so far of impact on COVID-19, I'm more than happy to share. So thank you.
Thank you so much, Dr. Cox. We'll come back during questions and answers, and then we might be able to share those resources with people that came in today. Thank you so much. I appreciate that. I will jump on to our next speaker. Again, we're not trying to rush you too much. I know everyone is trying to keep to their time, so we appreciate that. Our next speaker, I'll go ahead and introduce him, and then we'll have some more time for question and answers. Again, there are a few questions on the board. Feel free to put in those questions. We have some we've actually pulled in for our speakers. We'll come into that in a moment and share. But let me go ahead and speak about our next speaker real quick. We'll go ahead and share the screen so we can actually all go with this. All right, we have the bio of Victor Adegbola. Mr. Victor Adegbola is a therapist at Sun Behavioral Health in Columbus, Ohio. He started his clinical journey as a graduate intern at St. Joseph's Hospital Psychiatric Unit in Parkersburg, West Virginia. He subsequently worked as a social worker at the Franklin County Children's Services, and then as a therapist at Children's Hospital in Columbus and at the Central States University. In his more than 20 years as a therapist, he has worked with clients who have had various mental health challenges, including anxiety, depression, schizophrenia, bipolar, PTSD, and other mental health disorders and stressors. As an adjunct faculty, he taught courses in human development at the Ohio State University and abnormal psychology at Central State University and Wilberforce University. Mr. Adegbola earned his bachelor's degree in psychology from the University of Wisconsin and his master's degree in mental health counseling from the Ohio University, Athens, Ohio. He's married and a father and a grandfather. Ladies and gentlemen, I welcome Mr. Adegbola. Go ahead, sir. Yeah, I think we're trying to unmute you, sir.
Hello, can you hear me now?
Yes, we can hear you, sir.
Oh, wonderful. Yes. Good morning. Let me say hello, special hello to Miss Martin. Miss Martin, you may now remember this. Maybe a couple years ago, you and I met at one of your Saturday morning sessions to improve people's knowledge about mental health. So thank you for what NAMI is doing. And as a matter of fact, I want to let you know, I don't know if you see my t-shirt that I'm wearing. It says NAMI on campus. When I was at Central State University, we have a NAMI on campus. We won a grant, a mini grant that helped us to set up students who were advocating mental illness, about mental knowledge, mental health knowledge on campus and in our community. So that was a wonderful opportunity. Thank you. Dr. Cox, you and I, if you've been in Columbus a long time like I have been, you will definitely know Dr. Cox as well. Dr. Cox, do you remember you and I met several years, late 80s with Dr. Kelsey? Do you remember Dr. Kelsey? Yeah. So it's been a long time ago. Hello, good to see you again. I'm a retired therapist, really, but still engaged part-time in therapy because I love the profession and I love helping people. My wife and I are retired now, and then she has been teasing me, saying that we're retired, but we are not tired. So anyhow, I thank NIDO. NIDO, thank you. The African, thank you for inviting me to come and speak. I think this is a wonderful thing to participate in. I also want to quickly say something here, because I looked at the three of us, and I saw that there was no psychiatrist on the program, so to provide some medical side of things. So I took the liberty in taking permission from NIDO president, and he said it's okay for me to bring my niece. Her name is Juliet. I call her Lola Glover. She's right there on also, and please, you can unmute her to allow her to field questions, because she says she will be willing to answer questions that pertains to medical things. Dr. Glover obtained her undergraduate degree in biology from Xavier, her medical degree from Washington University in St. Louis. She completed her internship training in Washington University, Burns Jewish Hospital, before transferring to South Carolina. Her general psychiatry residency at geriatric psychiatric fellowship training were completed at the University of South Carolina. She's board certified. She's been practicing for over 10 years, probably 14 years now, I think, in general psychiatry. And she also is a full-time faculty as a professor at University of South Carolina. So thank you for accepting to come join us and make this a rich discussion. My goal for this discussion is to engage with you in discussion of how COVID-19 is creating stress in our lives and ways of coping with it. Stressors are external demands and the effects that are referred to as stress. Daily life hassles that include interpersonal tensions, financial pressures, meeting deadlines, family and work-related issues place demands on everyone. All situations that require adjustment are potentially stressful. Within the profession, our profession, the biological impact of stress is called allostasis. That's a concept that I wanted to share, which is the process of achieving stability through change and adaptation. When we encounter extreme stress, such as COVID-19 pandemic, we experience the fight or flight response. And in this response, if this response persists, it produces excess amounts of stress hormones called cortisol, which can result in a wear and tear on our body. High levels of cortisol can be beneficial, such as when we perform incredible feats of tasks. But if this high level of cortisol persists for an extended period of time, it actually causes dysregulation. And, oh, I'm sorry. I need to scroll down here. I'm technologically challenged, so so high levels, okay, I said high levels of cortisol can be beneficial, but when it's sustained in our body, it causes dysregulation and compromises the functioning of our immune system. So you can see, and you can imagine under COVID-19, when you need all of your immune system to be in high gear, if it's compromised, we can succumb very easily to COVID-19. Another concept worth mentioning is the diathesis stress model. Mental disorders are believed to develop when a major stress combines with a person's pre-existing vulnerability to a disorder. This means that mental disorders can be genetically influenced but not genetically determined. Hence, we have risk factors such as COVID-19 pandemic that can increase the likelihood of developing mental disorders. But the good news is that there are protective factors such as resiliency that decrease the likelihood of developing mental disorders. One example of resiliency is maintaining healthy human connections. Contacts with others. Once again, you can see the challenge that COVID-19 presents because it has disrupted physical human contacts. But we can find practical and creative ways of maintaining human connections. This brief overview of stress and stressors that I just shared with you is really aimed at gaining a better understanding of the connection between mind and body, and subsequently how to cope with this current pandemic. The coronavirus pandemic might have actually revealed some of society's perceptions of the and attitudes towards stressors. I think we do have an attitude towards stress in our society. People feel like they should not really be have to deal with stress. I have young children that are grown now, and I remember they used to say, I'm under stress, and they don't want to be under stress, but stress is a normal human experience, and we all should learn how to cope with stress. For example, people have been reacting differently to the stay-at-home orders. The governor has given us the stay-at-home orders. Many people to whom I have spoken have said, oh, they're stuck at home. Using or thinking about the phrase stuck at home could be a manifestation of extreme stress, because we know that traumatic stress can manifest as irritability, anger, and loneliness, among others. Are we really stuck at home? Yes, physically, in how we phrase it. However, the answer should be no. I saw a quote the other day that reads, you are not stuck at home. You are safe at home. So safety is really what we should be about. What a world of difference that would make to make our mental health if we reframed a stay-at-home order in that way. Being under extreme stress can also arouse reckless or self-destructive behaviors. Dr. Cox mentioned people drinking and engaging in behaviors that are detrimental to us. Okay, so being under extreme stress can also arouse reckless behavior, as I said, I'm sorry. So negative emotional states that may be responsible for what we are currently seeing. So what I'm trying to say here is that the behavior that we are actually witnessing in people going out with the negative attitudes about staying at home could actually be a manifestation of traumatic stress that people are trying to deal with. So being under extreme stress can create such, and some people refusing to wear masks. What is the big deal in wearing a mask, folks? It's to protect you, it's to protect me, for me to try to protect you, and for you to protect me. That's what we're asking. But even though we know these things, and we ought to know and understand the recommendations that's been given us, but folks, fighting against this. And I'm saying it could also be a manifestation of the fact that they're going through this traumatic stress and they just don't know it. And so they have short temper, anger, all this coming out. However, we also have witnessed the resolve of many people who have maintained optimism. So kudos to our frontline workers, professionals. We have a lot of immigrants who are nurses in our midst. And so healthcare workers, frontline workers, all frontline workers should be hailed, and they are heroes in this situation. So we thank them. So the question that remains is this: in the face of COVID-19 pandemic, how do we continue to foster optimism in ourselves and others who are vulnerable and are struggling to maintain resiliency? So I have some tips that I've put together, and I think we can put it on the slide that I want to share with you. Are the slides up there?
Yes, the slides are up here.
Okay, so coping tips, I call them. All of us should have these coping skills. Mindfulness is, and I think in reading about Dr. Cox's, she's told us about meditation. Being aware of our focus. So mindfulness is being aware or focus on the present moment without judgment. We need to practice that. Deep breathing, we need to be able to practice that. That really helps us. For those of us who belong to a religious organization, harnessing spirituality, pray, meditation, that's a good way to cope. Practice expressive writing. Explore feelings and emotions without regard for conventional punctuation, grammar. Just write about your thoughts of how you're feeling. Putting those things down can actually help us in coping. Engaging in gratitude journaling. I don't know about you. Building happiness into our lives involves being able to, at least on a daily basis, write down 3 things that you're grateful for. Be able to say that I'm grateful for being alive and for so many other things that we've been blessed with. Practice deep breathing, as I said. Create separate spaces at home for work. For those of us who work at home, you can set aside a particular place at home just for work. Create separate, limit exposure to 24-hour news cycle. We've heard this advice on TV as well. Let us limit our exposure to 24-hour news cycle, especially the ones that engage in sensationalism. Increase your locus of control. One of the things about coping with, being able to cope successfully with traumatic stress is being able to control things around you. So we have to be able to increase our locus of control. Do things that you have control over. When you wake up in the morning, make your bed. That's something you can do, okay? We can make our beds. So you have control over that. Increase, limit the things you're checking the cell phone. Oh, well, everybody checks their cell phone. Some people every minute, way too much. And for those of us who have WhatsApp, do you guys know WhatsApp? All the videos that come on WhatsApp, some of them are not even true. And so they're telling you about COVID-19 and all that. So please, please, please limit those kinds of things. Listen to your doctor's advice, not the politicians. Use cognitive behavior therapy. That's evidence-based practice that works. It helps us to regulate our emotions. Learn how to use it if you don't know how to use it. Go on driveway visits. I think I've gone on driveway visits to most of my friends' house and just wave at them, and it engenders good feelings, and we We talk 6 feet apart, wearing our masks, and those are good things to do. Check in daily with family and often with friends, preferably virtual visits and cell phones. My grandson, who is 4 years old, calls and says, "Grandpa, Grandma, I can't come and visit you because of coronavirus." So but at least we can do that. We can see each other on virtually. Practice self-care. Participate in support groups. Some of us who belong in churches, you have ministries in the church. Participate in those support groups. Schedule game nights. My son belongs to computer games with his friends. On Wednesday nights, he goes on his computer to do game nights with them. So do that. Join a book club. Take a class in psychology, first aid. NAMI on campus, I believe you guys offer, NAMI, Miss Martin, you guys offer psychological first aid training. I believe the Ohio mental health agencies also do that. So take psychological first aid. And those are some of the tips, and we can talk more about other things later on. Thank you very much for having me.
I tried to keep him on time.
Thank you so much. Appreciate it. I will go into the question and answers now. Shama will take over. Thank you to our speakers. Dr. Cox has been very active on the chat, so make sure you're looking at those answers as she gives those. For the speakers, if you want to share any information, feel free to put that in the chat. If you want any, and then for our guests also that are listening, if you have any particular questions, feel free to chat with and engage with them. It's not it's a real opportunity to have all of them together in one room at the same time. So engage with them, reach out to them. That's why we brought these resources to you. But I'll hand it over to Shami. Go ahead and let's go into the question and answer session. Thank you, Shami.
Thank you, Bukala, and thank you to all our speakers. So our first question is for Miss Rochelle. The question is, where are these NAMI classes offered? Where can you register? And are the classes free?
Great question. The classes are free. Everything that we do at NAMI is free of charge. And you can register for the classes online on our website. Our website is www.namifc.org. And you can register for our classes. We will have an upcoming class coming up very soon. If in fact you need to contact me, I will put my phone number in the chat box, and feel free to call me at any time. I can help in any way possible.
Sorry. Thank you. Thank you. Our next question is for Dr. Cox. The question is, where is the first point of call for a patient that seeks mental health? So where can they go at very first time when they're seeking mental health?
Yeah. And like I said, I believe in the prevention. So in my opinion, just any time that you feel like you need help, but if it's not realistic, all this wonderful list that, Victor has put out, when you know that you're not able to any of those things, then that's a time when you're saying like, I know that they're a good thing for me to do, but I can't just doing this breathing exercise anymore. I don't care, so there's a point where, what makes sense to you in terms of your stress management, but if you can't or you don't want to, and that's a really good sign. So what I suggest is, whether it's you or your family members, just look at your self-awareness of how you deal with stress, and when is a point where you just think that you can't do it anymore, or just a glass of wine might be really helping you to relax. But if it goes beyond, one glass of wine, and getting into this addictive cycle, And that's where you need to be aware of, hey, you know, what's my typical symptom? You know, the stress. And with this population, and I talk to Asian population too, I cannot underestimate the effect of both health and mental health of microaggression that we go through every day. You know, we don't know that we are succumb to is very obvious, and sometimes, you know, a lot of times it's not. And that's how, you know, just like Victor's saying about, you know, flight and fight, you know, that's clogging up our, you know, blood clots and heart attack and aneurysm. And, you know, it's being proven again and again how that's impacting on a cell level, you know, for us to continue to have a lower immune system than other people. I mean, why do you think it's COVID-19 is hitting us, you know, people of color? You know, it's not just a poverty. It's not about frontline and all that kind of stuff. For instance, my son is a, you know, frontline worker. And he's, you know, I'm one of those worried mom. He's out there every day. And guess what? He got the raise working on the Memorial weekend for $20 an hour for 48-hour shift. You know, I mean, come on. I mean, of course, you know, I'm also grateful for doctors and nurses, but we're talking about those young men and women who's a front line, you know, working their butt off, you know. So, I mean, talking about, yeah, I know he's willing to, he loves what he's doing as an EMT and paramedics, and, you know, he's just out there. But the point here is we need to really look at this whole microaggression, how that's impacting on our immune system. So all the good things that you know about breathing exercise and all that kind of stuff. I teach, you know, mindfulness, and some of my patients said, I can't do this breathing exercise anymore. I'm too anxious. I'm just, you know, I can't go to sleep. I can't, you know, I know it's good for, you know, for me. I know I used to be able to do it, you know. And also another thing too, CBT is really great too, but in my opinion, you know, it's a very much of a cognitive behavioral therapy that's based on white man's cognitive process. It doesn't really, you know, for many of my population anyways, you know, it's all like an English language, you know, dominated worldview. I mean, you remember Dr. Kelsey, Mariva Kelsey's, you know, legacy is Afrocentric psychology. So we need to really look at, you know, again, holistic way of not just a cognitive CBT that, you know, talking about the empirical data, whatever, but we have our own ancient Afrocentric psychology, Asians, you know, meditation. So we need to really look at not just the cognitive process, but the overall of how that impact on our immune system.
Awesome.
So, okay.
Thank you so much. All right. Our next question is for Ms. Rochelle again. And I think Dr. Cox was touching on this a little bit to say, can you speak to the disparity in mental health services among people of color?
I can speak a little bit about it because people reach out to me all the time concerned about whether their therapist understands their culture and their needs. And sometimes that happens all the time. And so therefore we do not have enough people of color that can address the needs of people of color. And so we have to rely on other people that are not of the same color, and they don't have the cultural sensitivity. They don't understand the culture that they are working with. This is a problem. So is there a solution? Of course there is a solution to have more people of color to come step forward and to be in our field. But, you know, that doesn't always happen. And I see Dr. Cox has her hand up to add some things to what I've said.
All right, thank you. Before we go to Dr. Cox, we're gonna go to Dr. Juliet, and she's going to talk a little bit about the point of entry into the mental health care system.
Okay, so can everyone hear me okay?
Yes, we can hear you.
Okay, well, thank you so much for allowing me to participate. I'm not in Ohio, but I am Nigerian. And I also want to thank our other speakers, my Uncle Victor, of course, Dr. Cox, and Ms. Martin. They have spoken so well on identifying stress and preventative measures, things we can do on our own. And I think, if I was reading correctly, one of the questions is, where is the point of entry when, that stress becomes more than just the stress that the average person is experiencing, and how do you seek help? Well, before you know to seek help, you have to know that there is a disorder present. So the people I'm seeing, the level of the symptoms that they're having has reached the threshold for a disorder. So where is that threshold, right? With the current stressors, COVID-19, riots, violence on television, those are external stressors that can overwhelm our coping skills and can overwhelm our baseline resiliency. And so I think that puts people at an increased risk. So some things that are more likely to pop up in this time period are issues with anxiety disorders, depressive disorders, substance use disorders, and maybe even PTSD, and then there may be some others, but those are the big ones. And they become a disorder when they impact functioning, significantly impact functioning. So they're overwhelming your functional reserve and your resiliency. So for example, with anxiety, we're all worried. We're all worried about finances, we're worried about catching an infection, we're worried about all these things. But is it to the point where the worrying is interfering with sleep? Worrying where you can't concentrate, you're overwhelmed with the worry. You're so worried that you're on edge, you're snapping at your family members, you're irritable all the time, you're tense, you're getting headaches, you're trying deep breathing, you're trying to distract yourself, and it's not working. That's the time to seek help. Depression, we're isolated, we may get lonely. Is it to the point where, you just don't want to be bothered? You don't even want to text. You don't want to call someone. You normally like watching TV, all of a sudden you're not even interested in that. If you try to watch TV, you can't concentrate, your mind is wandering. You don't have any energy, you're either sleeping too much or sleeping too little, eating too much or eating too little. You're feeling worthless. Well, where am I going? What's happening in my life? Feeling like a failure. Maybe thinking, I don't have a future. Maybe thinking, I don't care if I wake up tomorrow. Maybe a step further, I don't want to be alive. Maybe having suicidal thoughts, maybe even researching and starting to have a suicidal plan. That's a problem. That's when, and you don't want to wait till it's to that point, but recognizing these symptoms either in yourself or in the people around you, is a reason to say, hey, it's time to get professional help. With substance abuse, what's too much? If you look at what's defined as moderate alcohol use, it's 1 drink per day for a female. A drink is 1 beer or a 5-ounce glass of wine, 2 drinks for a male. And then what's considered binge drinking is 4 drinks for a female within 2 hours and 5 for a male. So anything above that is considered problematic. Not necessarily a disorder, but problematic. And so when you start needing more and more of the alcohol to get that buzz, to feel relaxed, when if you skip a day, you start getting shaky, where you're spending money that's supposed to be for something else, for your bills, on alcohol. Where are you driving and drinking? Is your family starting to criticize your drinking? Are you getting in fights because of your drinking? Are you noticing that it's affecting your mental health, your mood, but you're still drinking because you can't control it? You're craving it. You're trying to drink early and early in the day. We don't want to wait till it gets to that, but is it escalating? That's the time to get some help. And then of course with PTSD, if you're getting triggered with nightmares and flashbacks and you're always on edge and you're going jogging and you're worried that somebody's going to come after you, and that's a big one. I'm seeing people worrying more about being outside exercising. They may not meet quite the threshold for PTSD, but keeping an eye on those symptoms to make sure they're not going on. So if you're noticing these things, it's time to get help. And where the safest place I would say that most people would not even argue about going to get help is with their primary care doctor. There's no stigma with seeing your primary care doctor. So when the primary care doctor says, how are you doing? It's okay to talk about these symptoms. And they might be able to refer you either to a counselor or to a psychiatrist. Some primary care practices have a either a integrated system or a co-location of primary care and mental health. So when you talk to your families, and I'm going to such and such practice, they don't have to know you're going to see the behavioral health component of that particular practice. And so I don't know if there's something like that in Ohio, but here in South Carolina, we do have these practices where they're co-located and people feel comfortable. You know, I might have my primary care doctor appointment at 10 a.m. and I'll go see my therapist at 2 p.m. or whatever. And then of course seeing a psychiatrist for the medication aspect. Peer support is important, and so organizations like NAMI is very important for peer support for those who are suffering with mental illness, but also family support. Peer support for substance use disorder in terms of AA, and then Al-Anon for family members of those who are having substance use disorder issues. And then to continue to foster resilience is building your social supports. And that can be either friends, family, reaching out if you don't want to reach out, maintaining those people that you have there for you, and then spiritual outlets as well. That's a big buffer against mental illness. It's a big buffer against suicide. And so kind of maintaining those things that you do have, maintaining those connections can be important. So hopefully that kind of gives you some sense of when to involve someone like me and what kind of things to look for before it gets to that point.
Thank you so much. That was a very comprehensive answer. Just to follow up on that, I'm gonna ask Miss Rochelle, if you're in Ohio and you're a person, you are a member of this community, African diaspora, new immigrant, and you want to get help, but you do not have a primary care physician, where can you go?
So there is, as Dr. Juliet just talked about, in Columbus, we do have integrated care facility. Primary One Health is integrated. They do family health care. They also provide mental health care as well. So that is a great place, I think, that would be good. And I can provide you with that information. Primary One Health, and the one is spelled out.
Okay.
Okay. That's where Charlita Tavares, if you remember her, she was our state senator. That is her agency, Primary One Health.
Awesome. Thank you so much. We're going to go back to Dr. Cox and talk about, you know, that specific demographic and how we are doing with mental health and how we enter the system and how the system deals with us and the opportunities available to us.
So Equitas Health is another integrated, you know, and especially in the East Side, it's just wonderful. All the people are people of color and different sexual orientation, visibly very different care providers population. So that's where I refer some of my patients to. And I don't know about you, but again, it's just even a visible presentation of healthcare providers when you are just really in need, you know, it's very important. And that's a problem with the recovery community in Columbus, Ohio, or Ohio in general, is that if I send any AA, alcoholic, you know, heroin addict to AA or now other Al-Anon, you know, it's not anonymous, please, you know, so it's not, you know, it doesn't work. So it's a very different system for some of my patients who are biracial, multiracial, or they look visibly different or having a Japanese name or Asian name. You know, some of that system that works for white people, or, you know, it doesn't work. Even when, you know, we're trying to, you know, we're thinking about doing like a AA for Asians, it's like of itself is just such a, you know, problematic structure. So we need to really come up with our own recovery model so that, you know, we can still continue to have the benefit of that community, you know, in the recovery. But it's been very, very difficult, especially for that. And in terms of the pipeline, I have been working on this pipeline issues for promoting, continue to promote people of color to be frontline therapists and care providers. But, of course, remember, if we have, as a community, have a stigma about mental health, who wants to be a social worker? Who wants to be a therapist? Who wants to be a psychiatrist? Who wants to be a psychologist, So that's why I'm just going out there, in Columbus Public School and doing the, career day, talking about, some benefit of being a helper, and just being there. And that's where I can sell, because I have a sports psychology that's kind of sexy for kids, So if I talk about sports psychology, it's like, oh, well, maybe, So there might be a way to just really get the pipeline going to get out there and educating young people. This is a viable option. But as you know, in terms of, getting that salary and money, just like, I was talking to you about my son, and versus being an emergency room doctor, there's again is a discrepancy of a serious one for the income as a social worker, counselor, psychologist, versus neuropsychology as a hospital or brain surgeon or, whatever. And as we all know, Victor, right? I mean, we have to go to school for a long time, and if you can just be a psychiatrist, going shorter time than we do as a clinical psychology and getting a board certified way before we get licensed as a psychologist, I mean, and then the income is this. Who wants to spend all your 20s going to grad school and even a postdoc? I remember the income differences of postdoc in San Francisco General Hospital as a psychology postdoc to psychiatry, postdoc people. It was just like a big difference in San Francisco back in the 80s, So the point is, we need to really look at that structure to really educate people, but somehow it's a viable career opportunity for young people to get into as well, because we just really, have the demographic, of our mental health providers haven't changed, and it's really a difficult process. So every time, public health invited me to talk, that's one thing I'm just, talking about pipeline. So.
Awesome. Thank you so much, Dr. Cox. My next question is for Dr. Victor. The question is, how does religion fit in to stress relief and to stabilizing mental health? You mentioned it a little bit earlier, but if you can give just a more detailed explanation of in what situation would that be helpful, when is it not helpful, or when is that insufficient? We can't hear you. We're prompting you to unmute. If you go at the bottom left, yes, you can.
Thank you so much. Can you hear me now? Yeah. Well, let me quickly say something about some of what Dr. Cox said about, and Ms. Martin, about our profession, not having enough of us in there. Well, even my own family members, when I went into psychology, they were kind of looking at me funny and say, what do you do with that? And not only that, they looked at me and said, why? Why do you go into that? Why do you want to go and listen to other people's problems? It was something that was, because in our culture, as Dr. Carr said, it's something we don't want to talk about. So people are in denial about talking about family problems. It's something that you keep within the family that you don't talk about to outsiders. And that's what increases the stigma about this. But how do we, again, I hear this also within our Christian religion. I don't know much about the Muslim religion, but the Christian religion, I know some of my colleagues in that I'm a Catholic, and I once upon a time, I had a Nigerian Reverend Father ask me about counseling and said, "What is this counseling? You don't need that. You need religion. That's all you need. You need your Bible." And so we see this dichotomy that people have brought into the profession, and saying that one is better than another, or that you don't really need this, and thinking that psychology is one thing and religion is another thing. When in other words, in reality, when you look at most of the things that are in the Bible, it's actually in psychology books as well. It's amazing. I tell them that there's no difference. They work together. They're not separate or divided in each other. So we need to educate people about this, especially people in church, because I see a lot of people in church saying that they're not going to go to counseling. Seriously, they say they're not going to go to counseling. They're going to go to their pastor. Well, we have some pastors who are in counseling as well. So that's good. At least that can be combined. But how do I practice when I have folks who want to use religion? I use it with them. I use the Bible with them. And I said, well, let's go into the library. Let's see what the Bible says about what you. So if I don't force religion, I'm a Christian, I don't force it on folks. But there is no division in the two. They actually are in sync. You can give me any number of, I tell folks that CBT is actually in the Bible as well, because the Bible talks about our thoughts and how that can impact our actions. It's in the Bible. So I use the Bible to support some of the psychological principles that I work with. And I let people know that there is no division, and to convince them that this is wise, this is wisdom, age of wisdom that actually helps our mental health.
Awesome.
I don't know if that answers the question.
That is a very satisfactory response. I'm going to direct my next question to Juliet. The question is, how are people who already have mental health disorders handling the COVID-19 situation, and how are they getting help? Specifically with this situation, I just want to highlight that a lot of doctors are not seeing new patients. So how do people access that care if they need it now?
So that is that's a tough question, because if you're not already plugged into a health system, then it can be really difficult to get plugged in somewhere. Of course, there's always the emergency department, but you don't want to wait till it gets to that. The local mental health centers, I think still depend. I'm not sure the situation in Ohio, but here in South Carolina, they still are seeing patients. But a lot of practices here, both psychiatric practices as well as counselors, are doing telepsychiatry, which actually this question kind of hits right on a topic that I wanted to talk about. Is with COVID has forced us to get more online, to use the virtual visits much more frequently than we used to. And telepsychiatry is not new, telemedicine is not new, but it is validated as a useful tool, and that has outcomes equivalent to face-to-face visits. But for young people, they might actually prefer seeing someone remotely, because it takes away a little bit of the stigma. You're not going to a practice labeled behavioral health center. You're not sitting in a waiting room where other people, or you may be worrying about other people looking at you. So there's a little bit of that anonymity that I think may work for some people. And then, but for other people, they may not like it. It feels more impersonal, or they may not be as tech savvy. So there are pros and cons to that. But services are still available, and they're still available remotely. I know counselors who are still taking new patients, even if it's visits that are done remotely through HIPAA compliance. So HIPAA compliant media or forums, so the patient's privacy is maintained. And so that is something that I think is available in a lot of places, certainly available where I am. And so I would encourage people to reach out to, maybe if they have insurance, to look at what practices are taking patients, to find out if those practices are using telemedicine and instead of face-to-face visits. But it can be really hard, because I agree, the number of practices that are taking new patients in the midst of COVID has decreased.
Thank you, thank you. I think I'm just going to go to Ms. Rochelle as a follow-up for that question, to say what resources are available through NAMI, even if someone did not have a plug or an access to mental health care before.
Sure, thank you. I was nodding my head when Dr. Juliet was talking about services. So NAMI does still refer. We refer clients, new clients, old clients. We find them services. And one of the things that we do very well at NAMI is we engage with providers on a one-to-one basis. I find I have friends that are that provide care to patients, and I make sure that if anyone calls me, I make sure that I connect them and say, please, can you reach out and help this client? So because they need care. So we do have referral mechanisms to help people get into care. And can I add something about churches and mental health? Is that okay?
Yes, please.
All right, okay. So many years, well, it's been about 4 years ago, NAMI became engaged in working with churches on providing mental health care, well, providing education and awareness to congregations. And one of our very prominent ministers here in Columbus called me and wanted to attend the family-to-family classes, but he did not want to let anyone know that his daughter was living with a mental illness. And that was the reason that he was going to come to the family-to-family classes. With that, he attended the classes, the 12-week-long classes. He called me and he said, NAMI changed my life. With that, he began writing articles, monthly articles that come out on mental illness and the church. And he writes articles about this. So much so that another minister approached me about his congregation and wanted me to come and speak before his congregation. He invited me actually into the pulpit to talk about mental health and stigma. And I did that. And as a result, he now has written a 12-step program on mental health in the church. And I would be delighted to share that when we roll it out. We engage in what is called the Faith-Based Symposium. We are having one that is coming up. I believe it's going to be June the 27th. And we are going to be engaging pastors and bishops and talking with them around self-care. Because if you don't know already, there are a number of bishops and pastors that have been taking their lives, because of the stress that they can't talk about what's going on with them. So thank you for listening to me on that.
Thank you. That was a great response.
can't hear you.
Thank you. That was a great response. My next question is going to be directed at Dr. Victor. It is about being a caregiver for someone who has a mental health issue. I mean, you mentioned supporting, you know, our relatively healthy friends and peers and family, but what does it look like to be a caregiver for someone who has a mental health problem? We can hear you. Go ahead.
You can hear me now. Okay, wonderful. Thanks for that question. The one thing that I found, or that even in my practice, is very, for someone who does not believe in mental health or counseling, it's so difficult in trying to just use your regular style of convincing people to do that or to follow some of your recommendations. But one thing that I think works is empathy. You've got to be able to show empathy. You've got to be able, I know quite a few of us have gone for training a few years ago in trauma-informed care. And one of the things about trauma-informed care is to not only talk about safety, you know, but also to talk about empathy in sense of that we know, because as a matter of fact, I'm going to share that one sheet of paper with everyone later on. I don't know how we get that to you, but if they're going to post it. It's called the ACEs. It's an ACEs questionnaire. I have it here somewhere that talks about how several folks have gone through trauma in their lives, even as children. They grow up with trauma, and that has impacted the way they see the world. So empathy is one thing that we need to learn how to do. Don't ask people what's wrong with you, because when you put it like that, they're going to not want to listen to anything you have to say. Ask what happened to you. Ask them what happened to them, and give them a chance, a voice to be able to tell us what they've gone through. Let them be able to tell their story. And that's one way that we can invite people to become what we call therapeutic alliance in our profession. So when you have therapeutic alliance with people, then they're willing and able to listen to you and to also join with you and collaborate with you in their own recovery. And that's what this is about. I think caregivers need to learn how to do that. And if we do that, I think it will go a long way in being able to provide good care and also meet the goals and allow those other people to meet their goals for good health, good mental health.
Thank you, thank you. That is a great response. My next question is going to be directed at Dr. Cox. You've talked a lot about this. It's present in the Asian communities, present in the African diaspora community. It's how do we deal with the fact that our communities are in denial or they don't know much about mental health? How can we assist our communities so that they get the help that they need, or they're able to recognize symptoms in their peers, or they're able to be good caregivers? What can we do to help with that?
Well, like I said, you know, you just, hopefully this COVID-19 just shed a little bit of light for mental health, importance of mental health. You know, I see that a little more in the mainstream media about importance of that, you know, mental health. So, but at the same time, again, you know, it's just like, it's when it's gone, it's going to be gone. So we need to really capture this opportunity to really help educating people about importance of this resiliency, stress management. And of course, for many of us, we are talking about prayer and meditation as part of, or Qigong or yoga as part of our, Asian tradition to really mind, body, spirit connection. And, the topic that I've been studying or studying area is the last line of my bio is it's called orthomolecular medicine. I'm a big foodie. I'm, Japanese, so we put a lot of emphasis of food and health. So what I'm studying is to really look at food as part of the health and healing process. So that alone can be a mental health stuff and immune system booster. So what I'm trying to say is that mental health is not just this little thing that people think about schizophrenia and depression and anxiety and PTSD. We're just talking about just overall like a wellness and how we can just really continue to talk about mental health as not psychopathology, but also wellness and psychopathology, all of that and everything in between. So if we can continue to project that and helping community and then young people to understand this, because as if one suicide happens or bullying victims, then it's all of a sudden it's like a mental health, or it's a mental health month. Let's talk about mental health, but let's not wait until any incident happens. If we can continue to say, hey, for instance, a spinach is good for your health, and the mental health, or yeah, well, I mean, that's, or chocolate, so the point is, if we can just really put it in some kind of daily conversation, just try to take the stigma and taboo, about mental health. I mean, that's what I'm just trying to promote. And I'm just really happy to kind of get into this study of food is medicine. That's really, how we grew up, in Japan it's of course food is yummy, but it just really is a, nutrition for mind, body, spirit. So I really would like that kind of approach to really help people understanding that. And especially particularly we as, people of color, we continue to underutilize mental health system.
And the resources that we traditionally have. Thank you so much. I'm going to ask Julia to add on to that. I mean, I think Dr. Cox has highlighted food as a daily habit or a daily lifestyle part of our life that can help promote mental health. So again, like, what is mental health? And she's again highlighted that it's not just when we have extreme mental disorders. So what is it? What is it?
That's a tall order. I think it's, a lot of what I was hearing from Dr. Cox, and thank you for really highlighting the importance of wellness and prevention. And then also I've heard resilience come up a lot. And so, mental, and everybody might have a different take on what exactly mental health or mental wellness is, but it's really the ability to adapt and cope and continue to function irrespective of the stressors that are coming at you. And there are different ways to maintain that, whether it's, diet, exercise is a big one. I'm a big proponent for exercise in terms of its benefits, not just physical benefits, but emotional benefits, it's cognitive benefits. And there's a lot of research to support, those aspects of aerobic exercise and also other types of mind-body exercise like yoga, tai chi, etc. But, I wanted to kind of go back a little bit to the idea of stigma and, promoting wellness. I think people are much more likely to accept that and say, well, this is good for my health. I'll do this, I'll do that. And it's good for my health, both mind, body, spirit, etc. But what happens when it crosses that line to a disorder and you have somebody who refuses to get help or because of the stigma just doesn't acknowledge that something's wrong? And I work in a hospital, I get consulted, and sometimes I get consulted to see patients who don't know that psychiatry has been consulted. So you can imagine I walk in and they're like, who are you and why are you here? And they don't want to talk to me. And so, you know, I see that a lot. And, you know, in the community, it's, you know, family members trying to convince somebody to go see somebody. And one approach, it's not the only approach, but one approach that I found that may help is to just say, well, what do you think is going on? What things are you having difficulties? Let the person define, you know, what it is that they're struggling with. Because if you come in and you say, well, you know, they're concerned that you have depression, you know, well, they might not define what's going on with them as depression. I don't have that. I reject that. You know, I can see a Nigerian. I reject that in Jesus' name. You know, that's not me. But if you let them define it in their own words, you know, what is going on? Well, you know, I'm not sleeping. I'm just tired all the time. Well, then you can talk about some things that can help with those particular things, like exercise, like diet, like having somebody to talk to, or maybe it's time for a medication. So letting the patient define what's going on with them through their own cultural lens, I think can be something that's helpful.
Thank you so much. And is it possible, you just created a scenario for me that I didn't think was possible. Is it possible to get someone to come and see you or any other clinical psychologist that way? You know, hey, you just walk in the room and they were not expecting you. Like, how would
That's
that?
not recommended.
Exactly.
So yeah, we shouldn't trick them to do that. I wouldn't recommend that at all. You know, you could suggest seeing a primary care doctor. I've noticed you're just very listless or much more irritable, or sometimes if it's medicalized, I might say, well, I'll go see my primary care doctor. And then depending on how they interact, they may be willing to consider that maybe there is mental health aspects to what's going on, which doesn't necessarily mean medication or hospital or anything like that. It could just mean some other measures to help them to do better.
Awesome. Thank you. I'm going to ask Dr. Cox to add on a little bit to that.
So other thing that I wanted to talk a little bit about is that definition of mental health is, you know, traditionally what I think about, you know, is really the lack of self-care, you know, at the all levels. And I know Dr. Julia talked about the functional level, but especially, I hate to say this, maybe sounds like a stereotypes and I apologize, but, you know, some of the Asian, you know, it's a bimodal distribution for the Asian patients, you know, one population, you know, we can really measure mental health with a functional level, but we have such a large population of functional addicts, functional mental health patients, you know. And I actually see, you know, in African-American population as well too, they can tolerate this, you know, they are suicidal every day, but somehow nobody knows, you know. And so we need to also really have the radar out for people, you know, who are rocking a community, who does everything and high achieving, but they are suffering pretty severe mental health problem for years and years and years, you know. And in Ohio too, if you look at the statistic of a heroin addiction, opium crisis, it's just like your typical skid row, you know, typical addict to, we again have a bimodal distribution of pretty high functioning heroin addict that I just cannot believe, you know, last few years of seeing people who are able to maintain high level jobs and have been shooting up or, you know, addict every day for last 3-4 years, or top students, or, you know, so it's again, a very deceptive for us to really look at, you know, again, I mean, having said mental health is a lack of self-care, but there are people who are pretty looking resilient, looking pretty successful, who are very much of a high functioning mental health patients as well. And they suffer, and again, part of that is that because of the stigma, because of that is, you know, how can they, you know, as a very successful, high functioning whoever can come out as having lifelong chronic mental health, you know, problem or disorder, you know, that it just really is a difficult things for us to really grapple with as a profession. Yeah.
That definitely makes it a little bit challenging. So just to follow up, just to follow up on that question, this one's going to be directed at Ms. Rochelle. You talked about finding ways to get into the community and basically help people identify the problems that they have. So talking about NAMI, what other programs and activities do you do that help you get out into the community and help people identify, you know, mental health problems and how they can also deal with the problems they're facing?
Okay. So the question is, I just want to make sure that I understand getting out into the community.
Mm-hmm. Because instead of them coming to you, how are you going to them? Like potential mental health patients, kind of like what Dr. Cox was describing, people who seem like they're fine, but maybe if you have a conversation with them, they can realize something.
Well, traditionally, it has been through speaking engagements.
Mm.
I go to speaking engagements and people, after the speaking engagements, they want to follow up with me because they have some type of issue that they want to discuss and want to get some help for. So it's been that way. It's been from other people who have told them about NAMI, and they reach out that way. It has been from family members who have a loved one with a mental illness that may have another family that they are working with. Just last week, I'll give you an example. Someone that works in the system with me referred me to a family member was actually in the hospital, was in the hospital for a month and received some long-term care for a month. That's a long time to be in the hospital for some care. And the family wanted to connect with NAMI. So what we did was we did a Zoom with the family to get them the help that they needed. And then I'm getting ready to work with the person herself to get some care. So the referral came from someone in our system already that helped me to make this possible for the family. So there are innovative and creative ways.
And we appreciate those innovative and creative ways, especially from caregivers. My next question is going to be to Ms. Juliet. There's a question of if young people want to seek mental health care, but their parents are, you know, preventing them from doing that. How do you go about that? Or other people who are caregivers are preventing them from accessing that. How do they go about that?
That's difficult. So if we're talking of someone who is, 18 or above, then, they're their own, they're autonomous. They can sign their own paperwork and they can seek help. And maybe at first they just don't tell them. If we're talking about someone who's underage, unfortunately, they're going to need parental permission to get any kind of medical care, unless they're emancipated based on whatever the laws in that particular area. So that can be hard. Now, if there is some concern about a child, someone who's underage, who is obviously struggling and it's been recognized and the parents are refusing to get them help, I hate to say it, but it may be something to have, here we call it Child Protective Services to come take a look, because we could be looking at a case of medical neglect if we're talking about significant symptoms in this child, that they're not coping with whatever the situation is and the parent is refusing to get them help. Nobody wants to cause that kind of problem, but it can make a big difference in kind of the trajectory of that child's life.
Mm. Thank you so much. And you're right, I feel like there are other systems in the society, other members of the community who can step in if they feel like they can help and if they recognize that there's a genuine problem.
Yeah. Ideally, the best thing to do is to try to make it collaborative and talk to them, and that no one's trying to hurt, we're trying to help. But if it comes to it, then you can help authorities.
Thank you. I'm going to ask Dr. Victor to speak on the problems with, similar to this, in line with this, our culture and how it prevents people from talking about abuse and domestic violence, even just admitting that we're lonely, you know, especially when we're new immigrants and we've left our communities at home and we're coming to this country and we're dealing with something as simple as loneliness and how that adds to mental health problems. How, as a community, do we deal with that challenge of overcoming that idea that talking about our feelings or domestic violence or child abuse is taboo and it's something that, you know, should be kept quiet? We can't hear you yet. Just go ahead and click that and you can unmute yourself. Yes, we can hear you.
I am so sorry. I keep forgetting to do that. Well, thank you for the question. But before I had raised my hand when Dr. Glover was talking. I wanted to also, she mentioned a couple of times about medication. And when you asked her about the young people, it's not just young people anyway. There's several people that skeptical about medication, psychotropic medications. And I see that quite a few people may be struggling with mental illness and they start taking the medication, but because some of those medications have, quite a few of them have some not so good side effects. And so they stop taking their medication. And that's a challenge. We see quite a few people on the streets, believe it or not, some of the homeless people that you see on the, fall into that category, that they have mental illness, but they've stopped taking their medication. And so that has really robbed them of the kind of life that they could really lead. But so if Dr. Glover has time to go back to answer some of the questions in terms of how medications, because I don't know much about medications, she can tell us about that in terms of how, what are some of the things we can do, or what do they have stuff to counter the side effects of those medications where people don't want to use them because of that. You asked about domestic violence and well, you know, domestic violence, from my understanding.
Cultural.
Yeah, and specifically just the culture that, you know, prevents us from speaking out. I mean, yes, when it comes to even after someone has come out of that, the culture that prevents them from opening up and speaking up about this. And with children, child abuse, you know, being uncomfortable with putting that label on their parents. How do we deal with that as a community to say these are things that should not be taboo? If you're going through this, you should be able to speak up about them. Right.
Well, thank you for clarifying that. Yes, the cultural aspect of this, I think it has to do with education. I think we've learned certain things from our back home culture, okay? So to say. And some of the things, even, let me speak to the Yoruba culture, because that's the one that I know very well. The Yoruba culture, we even have a saying where we say that you don't air your dirty laundry in public. You don't talk about family outside. As a matter of fact, I remember when my junior brother came to this country for the first time, the first thing she noticed about me, she called me aside. She said, you're talking too much about your family. You shouldn't be saying that. You shouldn't be. He pulled me aside and told me that I was too open, that I was talking too much about, that I shouldn't be doing that. So it's something that we've learned. It's something that's in the culture. It's imbibed in the culture, even in the idioms and the proverbs that we use is inculcated in all of that. So for us to be able to change that, you're going to need a lot of therapeutic alliance. You're going to need a lot of really forming a lot of a good relationship, you know, what we call rapport, building rapport with the person, because that's the only way that they come to trust you. And to come to trust you so well that you are not going to take their information and publicize it or make it known to other people, that you're going to keep confidential. They're very big in confidentiality, and being able to keep it within a certain group of people. So if you can do that, I think that we can still reach them, but it's going to take time. These things take time. It takes time to be able to build rapport with people, to be able to for them to trust you, that yes, you really truly care about them, and that nothing bad is going to come off of this. So once you convince and once you are able to get people to that level, then it comes easy after
easier.
that.
Yeah, thank you so much. I think that's a valid point, that, you know, we have trained professionals who value confidentiality. I just want Dr. Juliet to talk a little bit about medicine and the value of medicine in dealing with mental health. Dr. Cox already highlighted to me in the comments that, you know, there's a bit of a difference in what works here and what people are trained in America, because the population is mostly Caucasian. So just integrating like the value, and then when problems arise, how we can deal with them while we are here in America.
So do you want me to speak on the role of medications?
Yes, the role of medication, and then sometimes why it doesn't work out well, or what goes wrong, and how we can deal with that as well.
Okay, so I think, you know, a lot of what we have been talking about falls more under wellness and maintaining health. And I highlighted earlier, you know, when something becomes a disorder. And so I think the lens with which I'm seeing things, I'm seeing the really ill. Okay, I'm seeing, you know, schizophrenic who's constantly hearing voices, who's delusional. I'm seeing a suicidal patient who's had multiple suicide attempts, a bipolar patient who's been up and not making sense. So, you know, medications work. In those situations, medications can help to reestablish mental stability so the patient can function, live at home, live in the community, hold a job, some very basic things that we want patients to be able to do. Because when the disorders get to that point, they're not even able to do that. Right? And so, you know, yes, there are side effects. You know, we discuss it with patients if they're able to even engage in a discussion of risk benefits. Otherwise, we're discussing it with the families. And then when they get better, you know, then we start working with the patient and working for them to develop some insight into, you know, what's going on with them. What is the role of medications in their overall treatment plan? Because otherwise you're going to deal with this revolving cycle of, you know what, I'm feeling better. I don't need this.
Yes.
You know, because I don't like this side effect. I'm gaining weight, or it makes me too sleepy. And so then they get off and then they're back in the hospital. So there has to be the buy-in on the patient's end as well. And that comes from working with them to develop some level of insight. And so, you know, some people, you know, think psychiatrists are all about pushing pills, but it's really about coming up with a treatment plan that works best for the patient. And for a lot of disorders, anxiety disorders, depressive disorders, medications is only one arm of the treatment. We talk about biopsychosocial, spiritual formulation and treatment plans. The biological might be medications. The psychological might be psychotherapy, CBT, DBT, or, you know, what have you. The social aspects, encouraging social support. The spiritual aspect, if the patient is so inclined. But taking that holistic approach and you know, making it clear to the patient that this is just one tool out of many tools to help you to do well. And we can work with side effects. Tell us what's going on. We have a lot more medications in our armament and options that we can choose from. So if one's not working or it's causing you problems, speak up. I want to know about it. And then, of course, monitoring labs and things like that to make sure that they're doing well.
All right. Thank you so much. I think that is valuable information. Medicine can help you, but you need to combine everything. And and I think you highlighted that self-awareness is a bit important. If your patient is so sick that they cannot even be self-aware to be able to recognize the side effect versus their own symptom of the illness, then it's going to take a little bit of time before you can have that back and forth conversation. And I definitely appreciate you highlighting again that the family is capable of being a part of this decision-making process if the patient is not able to make those decisions. All right, so we have come to basically the end of our conversation. I just want to thank our speakers, Ms. Rochelle, Dr. Cox, Dr. Victor, and Dr. Juliet. Thank you so much. We definitely want more questions. If you have more questions, we'll try to answer them. You can find us on Facebook. We're live streaming this. If you go into that and you send us questions, The African, we will get responses back to you. We have a survey that we would like for you to fill out before you leave this. I don't know if you guys can see that on your screen. Just go ahead and fill that survey out. And from that, we can end this conversation. I'm going to open up the mic so that Bukola can also say something and conclude the conversation.
Absolutely. Thank you so much. I mean, we thank all our panelists. We definitely appreciate you. I just wanted to give a round of applause to Shami also for that moderation. That was great.
Thank you.
Thank you so much, Shami. We definitely ran up to the time, not over. Ms. Martin, thank you so much. We definitely appreciate you and your time. I know you could have been doing a lot of things right now. We thank you so much. Dr. Cox, I mean, you were superb. You were running our chat and everything at the same time. We definitely appreciate you. Dr. Glover, you know what? You came in and you knocked this out of the park. We definitely appreciate that. And Mr. Adegbola, thank you so much. We know we challenged you on the technology today, but you were fantastic. We definitely appreciate your time, sir. And for the 4 panelists, we'll share that information with you. Your information, we'll share it amongst each other so you can actually connect from there. And for anyone that actually wants to get in touch with them, feel free to reach out and we will share that information with them. Thank you so much. The African and NIDOA Ohio put this together. I think Mr. Adegbola is trying to show something.
Sorry about that. Can you hear me?
Yes, we can.
Yeah, we're fortunate to have Dr. Glover, who has written a book. And I wanted to share her book and say, hey, just to give her a plug, that's okay. It's on geriatric telepsychiatry. It's appropriate because telepsychiatry is really good for COVID-19 now since you can't see people. So yeah. I'm sorry, Dr. Glover.
No, you're fine. I think Dr. Cox said you're a proud uncle, so we understand that. That's fine.
Yeah, I'm very proud of her. Yes.
All right. So thank you, everyone. We appreciate your time. You've taken the poll. If you haven't, just put some information in. We'll bring this again with other sessions. Great resource we had here today. Great people. Very active chat. If we're reading through, I couldn't catch up. We'll throw some information out there. We'll put it on our website, the NIDOA Ohio A.org. We'll put the video is going to be ready on also the African. They'll put that is actually live on Facebook right now, and we'll also share that in the future. We'll share that information with our panelists also, so we'll reach out to you. Thank you so much. I appreciate it. Again, we can't say more than saying stay safe, stay healthy, and we'll get through this together. I'll unmute everybody. Maybe the host, we can unmute everybody, and then we can say bye, thank you, and all that as we sign off.
Hey,
everyone.
Thank you all.
President, that was well done.
We can't say more than saying stay
Yeah,
safe,
thank you,
stay
everyone.
healthy, and we'll get through this together. Unmute everybody. Maybe the host, we can unmute everybody, and then we can say bye, thank you, and all that.
Bye, everybody. Good job.
Yeah, we're muted. You can say bye. We just give 1 minute for the byes. Thank you.
Mr. President, the VP, Good job.
Thank you. I know everybody wanted to say something, so this is your moment.
Yes, so
Please don't
Thank
It was, thank you, Shani. It was a great event. We appreciate that. Great.
they target them already. They start to profile them.
Thank you. So
Thank
we're
you
going to
so
shut
much.
it down now and have a wonderful
Bye.
rest of the week.
yes.
All right. Bye, everyone.
Bye.
Bye-bye.